the reason is that we haven't diagnosed all the people in this country with it. You know that we have a shortage of diagnostic kits and tests, so we don't know everyone who has it. And it is possible to have such mild symptoms you may not even know you have coronavirus. But let me give you a couple of facts. First of all, okay, generally the symptoms of coronavirus start a couple days, 2 to 5 days or so after you get exposed. However, they can come up to 14 days after exposure. The most common symptoms are fever, shortness of breath, and cough, but you can also get symptoms that remind you of a cold or the flu, things like nasal congestion or stuffy nose. You may get body aches, things like that, okay? But most people, 80% of people have mild to moderate disease, and they will recover from their symptoms after 1 to 2 weeks, which is wonderful. Now, those who have more severe symptoms, they may take up to 6 weeks or maybe even a little longer to recover, but the vast majority of people are likely to recover after a couple of weeks. You also asked me, so how would someone treat it? If I got it, what does my family need to do for me? What do I need to do for my kids? Well, it's supportive treatment, guys. That's acetaminophen, which is Tylenol, ibuprofen, which is Motrin, or products like that to help with fever and muscle aches. It's cough suppressants. It's nasal sprays to help with nasal congestion. It's what we call supportive care. Fluids, rest, take it easy, okay? So if there's one thing I need to tell you guys is, I know you're not hearing from the survivors, but just know there are far more survivors than there are people who do not. And remember, just because you get coronavirus does not mean you're going to die from it. Far from it. Most people do well, and most people will recover within a couple of weeks. Guys, stay safe. I'm Dr. Jen Caudle. We'll talk to you soon.